Hi everyone, my name is Anita Iyer and I run Ekansh Trust in Pune. Ekansh Trust is an NGO that works to empower people with disabilities. Demystifying Disabilities is our series of interviews where we talk to medical experts about different disabilities, what causes them, whether we can prevent them, how we diagnose them, and what we should do once a disability has been diagnosed. Today we have with us Dr. Milind Patil, who's an endocrinologist. Thank you for joining us, Dr. Milind Patil.
Thank you. Thank you.
Our first question is from a layperson's point of view. How would you define what an endocrinologist does? What does an endocrinologist actually do?
Yeah. So basically, endocrinology is a science which deals with the hormones, their production, from where they are produced, the part of the bodies which produce these hormones, and what happens when these hormone levels become excess or less, or the part from which they are produced get some diseases. So, in short, it is a branch of medicine which deals with hormonal disorders. So, to elaborate further, we have many glands in the body which produces the hormones. So, starting from top to bottom, we have pituitary gland, which you can consider as a central government of hormonal system, which produce many hormones and which control majority of the hormonal glands. Okay, so we get pituitary disorders with like acromegaly, a short stature, then
Okay.
prolactinoma, then we have uh, diabetes insipidus. Then coming down is another popular gland, that is thyroid. Now, there are many experts, non-medicals, who talk about thyroid in detail. So the thyroid disorders, hypothyroidism, hyperthyroidism, then you can get thyroid nodules, thyroid malignancies. Next to the thyroid, which is not commonly known as a parathyroid, it happens with when a big city is there, the adjacent city doesn't get the importance. So parathyroid is next to the thyroid, so it doesn't get that much importance in the media or in lay media. So the parathyroid disorders include hyperparathyroidism or hypoparathyroidism, then parathyroid malignancy. Then coming down is your pancreas, the most important endocrine part, which the problem with that leads to a diabetes, and which is the we are second in the number when if you talk about patients number over worldwide, we are the second in the number. Then there are ovaries, we get a PCOD. Then there are testes in the male where we can get hypogonadism. So these are the hormonal disorders. Other than that, there is something known as a gender dysphoria, where a person is born male or female, but their mindset is not happy with the what their body structure is. So that is known as a gender dysphoria. It's a psychological disorder where the person is not happy with the gender assigned by birth. So, for example, if a male is there, he will think that he is a female and he wants to get converted into female gender. So we deals with these hormone replacement therapy, where we assist them in change of their gender by providing the hormonal treatment. Again, lastly, we are against the substance abuse or misuse of the growth hormone, anabolic steroids for gym purpose or sport activity. So that those patients also come for endocrine
Oh,
consultation.
oh.
So this is a little bit extensive elaboration of what are the endocrine disorders.
Now, coming from our point of view, because we work
Yeah,
in the space of
yeah,
disabilities,
yeah.
which actually means that physical challenges or intellectual challenges or
Correct.
mental illnesses, which are of course caused by hormonal disorders. Also, I just wanted to know what are the different endocrine conditions that can lead to disabilities and how.
Actually, there are the endocrine. None of the endocrine disorder is directly covered under Disability Act of India, but there are many potential candidates which needs to be looked upon. So, starting from, as I told you, from we will go from top to bottom. Regarding the pituitary disorders, we, as I spoke you, the acromegaly, that means the growth hormone excess, that leads to the physical deformity. So
Gigantic.
Your height will be tall. You will have the large jaw, gigantism, what we say. Most important in this patient, they get osteoarthritis. Okay,
Okay.
and they get spine problems. Okay, so these can come in a disability. If you treat it on time, maybe a partial removal of this disability can be possible if you diagnose it early, but there will be residual disabilities in this patient. Musculoskeletal problems are more common in these patients. Then the second disorder, that is uh, from the pituitary perspective, is a Cushing syndrome. So basically, Cushing syndrome is a disease in which there is excess of the steroid hormones produced in the body.
Right.
That can be, the source may be from the pituitary or from the adrenal gland. So in these patients, you may get psychiatric issues. Then you may get in this patient osteoporosis, fracture, then the avascular necrosis of hip joint, so which can lead to disability. So avian. So these are two endocrine disorders which will be important from your perspective. Then we have short stature, growth hormone deficiency. So that is a common problem, where you will get a patient who don't, if they don't receive growth hormone treatment, they will remain very short. 13-year-old boy with height of 93 centimeters. So you can imagine a height of 3 feet, that should be appropriate at around 2 or 3 years boy. So these are the patients who get, they are very short, so that can be considered as a disability. Another issue with the pituitary disorder is that if there is a large adenoma, we'll not call it a tumor, because tumor people get only word is malignancy. So they are not; these are non-malignant adenomas. So if they are large, that can cause compression of the optic nerves, and patient may lose vision. Okay, so
Oh,
that may cause a loss of vision. Okay, so this is the list about the pituitary disorders which can be considered as a disability. Other than, now coming to the thyroid disorders, may in thyroid disorders, the one which can lead to disability is a congenital hypothyroidism. So common perception is that hypothyroidism means you will get a patient of reproductive age group woman who will have difficulty in conception or menstrual irregularity, but this is not 100% true. We get a hypothyroidism in a patient starting from a newborn baby to elderly patient. Okay, so in a newborn who are newly entered into the world, if their thyroid gland is not functioning properly, that may lead to neurological damage, and these patients will have mental retardation. So and this is because these babies are not clinically different. Abhi, if a patient of 30 years comes, she might tell you, "Ki, doctor, I'm feeling weight gain, so can you check my thyroid?" The newborn baby will not have that symptoms. He will look exactly similar to a newborn baby who do not have thyroid problems. So the only
right.
way to diagnose the congenital hypothyroidism is a new screening of these newborn babies with their cord blood, or third, on the day 3, you have to prick their heels and take the few drops of blood to check a TSH. So
Oh,
this simple test of doing a TSH can prevent the mental retardation. There is a case series was published from my alma mater Jipmer, where we have a series of patients who came at the age of 20, 30, like that, very short, with full-blown features of hypothyroidism. So when they were treated with the tablets, their physical problems were sorted out, but the mental retardation which they have got from untreated congenital hypothyroidism, was, we can't do that anything for
but you
this
can treat
patient
it in a
right now.
baby. But you can treat that in a baby and prevent mental
Yeah, we
retardation.
can prevent it. Yeah. So if you start a treatment early in the first 1 month, then you can prevent the mental retardation in this patient. So that needs to be taken care of. Then iodine deficiency, the least spoken disease, because so iodine deficiency can lead to the mental retardation. Then coming to the next disorder, that is a parathyroid gland disorders. So in parathyroid gland, the mainly what you get if hyperparathyroidism is there, then the bone becomes weak. You may
Right.
get a pathological fracture. Pathological fracture means fracture which can occur with only small trauma. Like if you fall down from a bed, that will not be a big trauma, but that may broke your bones.
Like brittle
So
bone. Are you saying it
yeah,
will be like,
brittle bones. Yeah.
okay,
Okay, so that is one condition in hyperparathyroidism. Then hypoparathyroidism paradoxically can lead to increased risk of fracture. So these are the two disorders of parathyroid which can lead to a disability. Now coming to other endocrine, the disorders that those known
right,
as the metabolic bone disease. Metabolic bone disease are the diseases of bone where you have increased risk of fracture. So starting from little starting from childhood age, we have a predominant disorder known as osteogenesis imperfecta,
right,
where the bones are brittle. They may get fracture, and if you diagnose these patients early, you can prevent the further fractures. So that is one beautiful response you when you start treating this patient with drugs called as a bisphosphonate. The frequency of fracture get reduced, and the parents are happy, and the patient is also happy that they don't get much fracture. So osteogenesis imperfecta is one thing. Then osteopetrosis. These are the rare disorders, the metabolic bone disease spectrum. Then in vitamin D deficiency, that can lead to pseudo fractures, and that can osteomalacia that can cause a bone pain, and these patients may get a fractures. Okay, then there is something called as a Paget's disease. Paget's disease is generally seen in elderly population. So in this disease, the alkaline phosphatase level goes haywire, and the patient may get pain and they can get a fracture. So then fibrous dysplasia. Fibrous dysplasia is a condition in which the patient has deformity in a bone. The bone shape will be altered, and they will have some other hormonal issues in this patient. So this is one spectrum of metabolic bone diseases where we have to look at this aspect and make general public and also doctors aware about these disorders. Now coming to a diabetes, diabetes, there is a lot of thing to talk about
absolutely.
diabetes. Yeah, so it can lead to disability from various reasons, like you may get foot problem that lead to amputation. You may get a nerves problem that may lead to loss of sensation and feet, and you may get injury which may go unnoticed. Then you may get a cataract, eye problem like cataract. You may get diabetic retinopathy, bleeding
Right.
inside the eyes, and that may lead to the blindness. Then deafness is one thing which you may get with diabetes and the metabolic bone diseases also. uh, then you may get if severe hypoglycemia unattended, if patient gets unattended hypoglycemia, that may lead to the neurological damage. Okay, so these are the various then coming to the reproductive disorders like PCOD women, they are at increased risk of depression. I'm not sure whether depression comes in
It does. It comes
disability.
under mental illness, depression, anxiety,
Okay,
mood
okay.
swings,
Yeah, so
all of that.
yeah, so that is one thing. In a male with hypogonadism, again, they may get mental illnesses. Then in a patients who are known as a Klinefelter syndrome, where there is a hypogonadism, these patients will have some mental illnesses. So I think this is the whole spectrum of endocrine disorders where disabilities can occur, either intellectual disability or physical disabilities.
See, the moment nowadays, you must have noticed, especially on Facebook and LinkedIn and everywhere, people are saying, oh, during COVID, the number of people with mental illnesses is going up. There are so many people having anxiety and stress. And I'm thinking that so much of it could have been probably, to do with the endocrine glands and the hormones rather than COVID itself. So they say, go to a counselor, go to a psychologist, go to a psychiatrist. The first reaction is, why don't you go for counseling? Whereas they might actually need to come to you and not a psychologist. How do we actually differentiate between this, and how can we get the help of doctors like you who are willing to say, yes, we didn't know that, these things are listed. And how can I make sure that the list reaches all of you? What kind of help can I get? And what are the associations? Indian Medical Association is there, but how do I get through to them and, sort of tell them that they have to make people aware of
So
where the
the,
problem actually
yeah,
lies.
so the
That it
best
can be
ways you
solved.
may, yeah, best ways to reach to the medical colleges. So it is not included into the curriculum. It needs to
Oh,
be included into the curriculum, like
wow.
disabilities. What are the disabilities? How there should have to be some chapters or something. If I'm not forgotten, there was no chapter, so I'm not sure whether they have added something new or
I wouldn't
something.
be surprised.
Yeah, yeah, yeah.
Yeah.
So honestly speaking, that is one way where you can go to this thing. Second way is maybe approaching to the medical bodies where you can go, or maybe interviewing many doctors that may help in reaching to this awareness about the disabilities.
Yes, yes.
One thing I've not spoken about disability is a type 1 diabetes, which
Okay.
need a special mention. Okay, so type 1 diabetes is a disease where children will get the problem, and 100 years back, exactly 100 years back, there was no treatment, and once you are diagnosed with diabetes, the death was the only outcome of that disease. What with the discovery of insulin, the we have come to a state where patient can live life, almost normal life, but these patients get frequent hypoglycemia, hyperglycemia, then the complications of diabetes. So then there is a lot of psychological trauma, stress, in these children. So the stress is there in the family. There is even in the physicians who treat these patients, there will burnout phenomenon occurs.
Oh,
So there is a lot of things which you can do, especially in type 1 diabetes patient. There are only few NGOs who are working in the field of type 1 diabetes. I had done the extensive search during my DM time, and I could not find out many NGOs. There are only few NGOs who are actually working in the field of type 1 diabetes. I think more NGOs should come into this disease, because it affects whole family. It doesn't
right,
affect one children. If a child is having type 1 diabetes, the parents get stressed out that whether their baby will get hypoglycemia at any time. Then the earning person gets troubled by the cost of treatment. So
right, right.
it affects the whole uh, uh,
Family, the whole setup.
yeah,
Yes.
whole family,
Yes.
yeah, financially as well as psychologically.
In fact, most of the disabilities, and I'm speaking to doctors like you, I'm finding that many of them can be prevented, and prevention is so much more cheaper,
Yeah, yeah,
and there's less effort that is needed to prevent than to cure and to manage later once a disability is detected.
yeah.
The next question I wanted to ask you is: can endocrine problems in a mother lead to a disability in a child?
Uh, yes, if mother is having hypothyroidism, which is not treated, it can lead to the intellectual disability in
The
child
child.
in terms of reduction in IQ. It may not lead to complete mental retardation or like that, but there is definitely untreated hypothyroidism can lead to the uh, impairment in IQ. Then, if a maternal diabetes is there, that leads to the large babies, and during the delivery time, these babies may get injury to their shoulder that can affect their nerves, and that may result in paralysis in their hand. So that is one thing. Among other endocrine disorders, maybe Cushing syndrome in mother, or acromegaly in mother can affect the baby.
Thank you, doctor. And most of these disabilities you believe can be prevented, right? With testing at the right time
Yeah,
and treatment being given at the right time.
yeah.
Okay.
So yes, as I told you, congenital hypothyroidism, that is the preventable cause of mental retardation. What you need is only one TSH. It will cost you only 150 rupees per 150 to 200 rupees max
For
to max.
test. Mm.
If you do it in bulk, there will be further price reduction. But there is no government policy of the government for screening this common disease. Uh, at remote places, not many people are testing the congenital hypothyroidism. So I think there is a need to increase the awareness about this preventable cause of mental retardation.
Do you believe that people come to you at the right time? Do you wish sometimes that the patient had come to you earlier?
So sometimes they come at early at on time. Sometimes they come very late, or sometimes they come when there is no problem. Actually, okay. So all things happen. So it depends on the patient profile. If the patients are educated, and not only educated but educated and having scientific approach toward the medical fraternity, they come on time. Or otherwise it becomes some patients with diabetes, they will go to uh, there are many quacks in India. Actually we need to fight against those quacks. They go to the quack. I will tell you example. A patient with type 2 diabetes stop all the treatment and
Wow.
Google some online or some Baba's medicine. She took it for 2 years. She was educated. So, but not only education doesn't make patient aware of the condition,
Right.
and they were literally blaming all the doctors. They are just giving the tablet. They are just giving the tablet. We want natural cure of diabetes. So, and the natural cure caused her a lot. She developed a foot infection. She has to go undergo the amputation. So this is
Wow.
a every I will say among the 100 patients coming to me, 2 3 patients will have this problem, especially in the field of diabetes. Because what happens, if you have diabetes you may not get the symptoms, and it's a natural tendency of any human being to avoid the treatment if you don't have any
Correct.
symptoms. So अपना कंसेप्ट ये है कि इफ इंडियन मेंटेलिटी का कंसेप्ट ये है कि मुझे कुछ प्रॉब्लम होगा तो ही मैं ट्रीटमेंट लूंगा,
Correct.
otherwise I will not take a treatment. So that happens especially in terms of diabetes and hypothyroidism, diabetes and hypertension. So people don't have any symptoms, so they don't take the medicine. Or even if doctor has prescribed the medicine, अरे इतने में गोलियां से किडनी खराब हो जाएगा, लीवर खराब हो जाएगा. So all those quack वाला जो things है, they
Indulge
put
in that.
these
Yeah.
things in the patient's mind. Patients stop the treatment or they don't take treatment on timely basis. So what happens, diabetes is a slowly progressive disease. Okay.
Correct.
So initial 5 10 years are very important. There are large studies about the diabetes. Like I will quote the few studies, UKPDS and DCCT, which were large clinical trials, and they were done when there were not many diabetes medicines available. And these studies have proven beyond doubt that initial 5 10 years, if you control the diabetes properly, the long-term complications can be reduced to a great extent. And in India, majority of patients waste their time when they get diagnosed with the diabetes. So if a patient get diagnosed with diabetes, first thing they will do. I'm not talking all the patient. Few of the patient, they go in denial mode. They do it from other lab, and then they think that they will be able to cure it by doing some exercise or diet therapy. And when they come, by the time the HbA1c has gone around 10 or 15, like that. So we actually need to what I feel is that to prevent the disabilities in diabetes patient, we have to government has to take strict action against the quackery, the false claims, the people who make the false claim. But there is no governing body is, I think, serious about these people. And every social media platform or even a news channels will show
Yes.
their
Yeah.
ads in a prime time slot. So I think that needs to be looked.
Yeah.
Not this may not be relevant for today's, but yes, I think this is relevant because by the time the patient get kidney problem, he has already lost the important things, so which could have been prevented. Another thing is hypertension medicine, blood pressure. Patient don't take the blood pressure, and when they come with the paralysis
Right.
because of the not taking medicine. Their blood pressure goes to a great extent, like 180 200 tak jata hai. Then there is some bleeding inside the brain, and they get a paralysis. So that results in a disability. So what I think is we have to make people aware about the scientific process, what is the diabetes, and they have to, this mistrust is being created between the doctor and common public by some quacks and all those things that needs to be cut
Yeah.
out.
One last question to you, doctor, before we finish our interview is, what is your message finally to our viewers? What would you like to tell our viewers?
Okay.
Our viewers could be doctors or, lay people. What would you like to tell them?
Yeah. So what? Okay. So my final message will be give importance to your health. Check on time. If a doctor tells you that you have to take the medicines or you have to follow lifestyle, please follow the proper lifestyle and take the treatment properly, because that can prevent disability in patients.
Thank you so much for your time. You've
Thank
been
you.
most generous in sharing information with us, Dr. Patil. Thank you, MQ Pharmaceuticals, for being our sponsors. Thank you, Team Ekansh, Priyanjali, for the back-end support. Thanks to all the viewers who are watching this, and I hope this has been as enlightening to you, for you, as it has been for me. Thank you very much.